Now that we have such safe and effective medications to treat obesity, our GLP-1 agonists like Wegovy and Zepbound, what is the role for bariatric and metabolic surgery? Is this going to become a thing of the past? I don't think so, and I'm going to tell you why. My name is Dr. Lindsay Ogle, and I'm a board-certified family medicine and obesity medicine physician. I am not a surgeon, so my focus really is on utilizing our GLP-1 medications as well as some of our other medication options that we have, and I have a video that goes over all of those options that I will link here. So I don't have a vested interest in bariatric and metabolic surgery, but I often refer my patients for consultation with these surgeons because I do think it's a safe and effective and great option for a lot of people. So before we talk about who would qualify for bariatric and metabolic surgery, let's go over a couple of common misconceptions about this treatment option. The first is that it is cheating, and that is not the case. We know that obesity is a chronic medical condition, and like any chronic medical condition, we have levels of treatment. And oftentimes that includes lifestyle, medication options, and sometimes surgical options as well. Obesity is the same. If you're working with an obesity medicine physician, they will be trained to go over all of these options with you to pick which one is best for you in your situation. The second most common is that surgery is seen as a last resort. And I don't think that we have to wait until we have tried every single option before we get to surgery. I think it is something that could be considered for the right person at that first consultation. There's no need to delay our effective treatment options that we have available. And then the third is that these are unsafe surgeries. The truth is that over the past several decades, our bariatric and metabolic surgeons have really honed their skills, and most of them, this is the only type of surgery that they do. And so they are very skilled in these procedures, and most work within a certified surgical center that will ensure that they are complying with regulatory standards, including pre-op and post-op visits to ensure safety for patients of that practice. And really in the immediate post-op period, it is as safe as getting your gallbladder removed. That is how great these surgeons have become at bariatric and metabolic surgery. So who qualifies? Anybody with a BMI of 40 or greater qualifies for metabolic and bariatric surgery. Anybody with a BMI of 30 and has type 2 diabetes or a BMI of 30 and has tried other interventions to achieve a healthy weight for them and has not been successful, they will also qualify. And of course, this is something that would be individualized beyond this with the consultation with your surgeon. So they'll get into the nitty-gritty about what is safe and effective for you. And also, just because somebody medically qualifies, unfortunately, that does not mean that insurance will cover the procedure. So that is something to consider and look into as well. Oftentimes, these bariatric and metabolic surgery centers have a team that will help coordinate with your insurance to let you know what will be covered and what might not be covered. So the two most common bariatric surgeries that are completed in the US are the sleeve gastrectomy and the RNY Gastric Bypass. The sleeve gastrectomy, sometimes referred to as the sleeve, tends to be the most common. The surgeon will remove a portion of the stomach but leave the intestines in place, and so it has less risk of malabsorption compared to the RNY Gastric Bypass. But the most common side effect with this procedure is a higher risk of acid reflux. We used to think that it mainly worked by causing a physical restriction with that smaller stomach, and that definitely plays a role because the stomach will be at a much smaller size, and so it will start to signal fullness and with those stretch receptors at smaller portions. But we also know that by removing most of the stomach, we're also removing a lot of the cells that release ghrelin, which is our hunger hormone. And so with less ghrelin, you're not feeling as hungry as you normally would. And so it really helps by decreasing hunger and helping with fullness, which is really similar to our GLP-1 medications. The expected weight loss is usually expressed as excess body weight loss. So this is the excess amount of fatty tissue that somebody starts with and that they will lose after surgery. So it's a little bit more nuanced than how we typically describe weight loss with medications when we're talking about total body weight loss. But with the sleeve gastrectomy, we typically expect 60 to 70% excess body weight loss. For the RNY Gastric Bypass, the surgeon will create, again, a small pouch in the stomach, but they will also take a portion of the intestines further down the line and then bring it up to that stomach pouch. And so by doing that, they are bypassing much of the intestines, which will decrease absorption, so less calories and nutrients are absorbed in the intestines because of that procedure, which leads to a higher chance of nutritional deficiencies and highlights the importance of needing to monitor for these nutritional deficiencies for the rest of that person's life and taking supplements to correct that or prevent those nutritional deficiencies. But the benefit of the bypass procedure is that there is, on average, more weight loss. This is also what is recommended for patients who have obesity and type 2 diabetes, because we see very high rates of remission of type 2 diabetes. So patients are able to get their A1C even to a normal range, often without needing medication long term when they've done a gastric bypass procedure. It's less likely to cause acid reflux, which is a big benefit, and it has a bigger impact on the GI hormones like GLP-1. As I mentioned earlier, qualifying for bariatric and metabolic surgery does not guarantee that your insurance will cover the procedure. So definitely check with your insurance provider to see if this is something that they offer. But if they don't, most clinics actually have a package that you can purchase that would include your pre-op, post-op, and surgery all in one package. And the cost can really range here. But if you're looking at the cost of using a GLP-1, which can be anywhere from $350 to $1,000 a month, if you add that up over the course of a few years, or even indefinitely, because we know most people with obesity need long-term treatment with their GLP-1 or with their medication to manage this chronic medical condition. So if you're looking at the big picture, spending that higher amount up front may be the most cost-effective way to manage your obesity. So cost, of course, plays a role, but I think it's really important to look at that big picture and what that cost is going to get you, because we know that patients who undergo bariatric and metabolic surgery lose a very significant amount of weight. They're often able to reduce their medication burden for chronic conditions and improve their chronic conditions like high blood pressure, type 2 diabetes, arthritis, sleep apnea, fatty liver disease. They decrease the risk of cancer and they live longer. I know it can be a lot in the cost up front, but it's really important to consider everything that you're gaining for that cost as well. So I don't think that bariatric and metabolic surgery is going anywhere. It's a great option. And sometimes we even utilize our GLP-1 medications for a few months or years, and then we do surgery. Or sometimes we do surgery and then later on we need to utilize the GLP-1 medications or other medications to augment the surgery, or if there was any weight gain after surgery, then we can utilize medications in that time. So I think it's a great adjunct. I think it's a great option, and over time, we are going just to continue to have more and more options for the treatment of obesity, and I'm so excited to learn more about these. I'm actually going to the Obesity Medicine Conference at the time of this recording. I'm going in a couple of days, and I'm going to do a video about all of the new medications that are in the pipeline to be approved. So I'm so excited to go over those with you. So subscribe so you don't miss that video, and I'll talk to you next week. Take care.